All right, so yes, the answer was E. So remember that H. pylori can lead to a maltoma, and this is like a description of a maltoma. Here's my mouse. Let's go down. Micro. All right, so 38-year-old female, early satiety, epigastric pain, um, loss of rugal folds, cells with a lot of mucus, right? So this is describing what? This is describing the diffuse type of cancer of the stomach. And these guys, in addition to lobular carcinomas, have eccaterian problems. That's why they metastasize really readily. Horrible prognosis too. 7-year-old. Oh, this is not a path question. So this question, already like this is supposed to be intestine. I already see that there's not a lot of villi, but there's a lot of crypts. And there's a lot of lymphocytes. It's characteristically for celiac disease. Uh, and also, here, bread, bulky. Yeah, this is a celiac question. And also descriptive. So, which of the what is it associated with this condition? Let's read. Uh, Megaloblastic anemia. It's interesting. No. So celiac can destroy the duodenum a little, right? The idea is if this is your intestines, it hits the first parts, and that's where iron is absorbed, right? So if you do get an anemia, it wouldn't be a megaloblastic one; it would be a microcytic one. The tropical sprue that hits like towards the end, and that's where B12 is absorbed. So if you have that one, then it makes more sense to have megaloblastic in that case. Peptic ulcer disease doesn't make sense. Fistula formation doesn't make sense. That's for Crohn's. Toxic megacolon doesn't make sense. Intestinal lymphoma is your answer. And remember, we have a lot of like these are a lot of cells here. I think they're T cells. So we have a specific like a T cell type of tumor. Um, I think it's like something eat T, something like that, or T eat or something like that. So we have a specific type of T cell lymphoma here. It can form as a result of celiac disease. So this question isn't technically path, but we're going to do it anyways. 7-year-old boy is basically uh, describes a boy who ate a burger and now has low platelets, right? And right, low platelets. Okay, what a scary place to be to have low platelets after eating a hamburger. So this is like HUS, hemolytic uremic syndrome. Uh, there's not a lot of this. Oh, and we got purpura on the left arm. So this kid has low platelets because basically what happens is that the toxin that the bacteria produces it damages the endothelium, and then platelets stick to the endothelium, and they kind of like as now blood cells are going past here, they kind of cut blood cells into half, so they like look like these helmet cells, and these helmet cells are known as schistocytes, and also you are using up a lot of your platelets, so you at other places you're like kind of like bleeding spontaneously, so you get purpura, and that's what purpura is. And but your PT and PTT are kind of like within normal ranges because you're not using them. If you were using them, it would more like look like a DIC environment. So yeah, you do see schistocytes, and also you get some clotting into your glomeruli, and that is really what leads to the hemolytic uremics, the uremic part of the syndrome. So you'd also see high like kidney stuff, like high creatine stuff like that in this kid. E, right? Okay. 68-year-old has had diarrhea, hyperpigmentation of skin. Okay, that makes me think of high ACTH. Okay. I don't know why this guy has hyperpigmentation of skin, but it's not a ACTH question because a biopsy of the small intestine shows PAS staining descended macrophages. So it's the Whipple disease thing. So basically, this bacteria, it's called this, goes into the macrophages, and the macrophages like in the villi. And if you remember, in the villi, there's like these lacteals that basically are lymph, and they take like all the fat that's getting absorbed. They take all the fat into like back into blood circulation, and so these macrophages, they're like they get big in this disease and they block these lacteals, so you get like fat malabsorption, um, and you get like you also have cardiac symptoms and neurologic symptoms in this disease, right? But the PAS staining is really gives it away. Yeah. Okay. See what this says. 70-year-old woman, pain in the right upper quadrant for the past week, yellowing of skin. It's itchy. Okay, it makes me think of like bile can't get out, so it's not getting out of like the biliary tract is getting out in the tissue. That's why you're getting the jaundice. That's why you're getting itchy. Stage hormone replacement therapy, menopause 2 years ago. Some tenderness in the right upper quadrant, kind of like reinforcing what I thought. Guarding, positive, shifting dullness. So we got lymphocytes and plasma cells in the portal tract. The hepatic globules, so autoimmune hepatitis. Right. Now, I don't exactly haven't read too much into it, but I know it's anticentromere. Sorry, not anticentromere. It's anti-smooth muscle. Anticentromere is in lupus. That's as a result of no, actually, I don't know what anticentromere is, but I know this is this is uh, the anti-smooth muscle, right? And you have basically a description of what we experience here. They have anti-smooth muscle and they have also ANA, which is anti-nuclear. Type 1 is in adult, type 2 is in children and teens, and anti-kidney microsomal type antibodies also seen in type 2. All right, 79-year-old man, hemoglobin is 10.5. There's hemolytic anemia. There's hemocult. Okay, old guy with hypochromatic anemia. Old guy with iron deficiency makes me think of bleeding out of, and also positive hemocult is bleeding out of somewhere, right? And a couple of things it could be, it could be cancer. It could also be angiodysplasia, I think it's called. Either way, you have to do a colonoscopy. 52-year-old woman. Um, Her poop floats, so that's the description of like fats aren't absorbed for whatever reason, and she has jaundice, right? There's fibrosis of the pancreas, right? So that's due to what? That's due to chronic pancreatitis. And so she's saying which of the following is the most important risk factor for this condition? Chronic alcoholism is one. I mean, in this case, it's not cystic fibrosis. It's not gallstones. This is chronic pancreatitis. In this case, it's chronic alcoholism. It's like, and that's probably the most important, anyways. Most common, at least. 52-year-old woman, 2-year history of vomiting blood, 7 pounds, multiple calluses. Okay, so calluses back of the hand is, I think it's called Russell sign. It's because of like trying to gag. So this girl induces vomiting. That what that predisposes you to is the Mallory something syndrome, whatever, I don't know the name, but that basically means longitudinal tears of the esophagus. Uh, yeah, here longitudinal laceration of mucosa. Yeah, basically to just tear their esophagus. Um, so this 62-year-old has lost 10 kilograms. Makes me think of cancer. Um, there is elevated total and direct bilirubin, right? Biopsy of the mass confirms diagnosis of adenocarcinoma. So maybe it's hepatocellular carcinoma. Maybe, I don't know. No, it's not hepatocellular carcinoma. Okay, that would have been adenoma. It is. It also says here that there's pancreatic insufficiency because of the oily stool. I don't know, somewhere around here says it. So we are thinking of a pancreatic type of cancer, which would give us C. Is that it? This is all. This is all interesting. All right, thank you. Super tired.